So Sandra, followed by Lisa, and I'm going to really keep you to time, and they're reflecting on what they think about the data to help them inform policy and practice and any other work that we're doing here. So Sandra, followed by Lisa.
Thanks, Maree. That was a great place to finish there around placement stability. I thought I'd just reflect on a couple of things that relate particularly to the work of the OSP and in terms of practice in the field, and how that's, I suppose, the significance really of the study to that work. One of the things that I read about one of the key aims of the research is that it's crucial to have a good understanding about how children come into care or come into the child protection system, their experiences prior to and in out-of-home care, and how these and other factors come together to shape child development and placement trajectories over time. And I think that's really critical in terms of the work that we're doing. I think it relates really well to our to our care and protection practice framework, which gives us a mandate for respectful family work. And it's really interesting in the study, like thinking about the breadth of what family actually is, considering kin, birth, foster carers. Our mandate is to understand each child's experience, build on relationships with parents, families and communities, and use collective wisdom, skills and courage to achieve change. And I think especially keeping children and young people at the centre of our practice and working particularly with families. So I think the study itself gives us a really good insight into the challenges, but the opportunities within the different cohorts and the family that children might actually be with, whether that's in foster care or in kinship care. We build relationships to create change, so good collaboration enhances each other's capacity as well as sharing authority and power. And I think Ilan made a really interesting point about talking about casework in terms of service provision, including direct care to children and families, but also acting as a conduit, I think you said, Ilan, to other services. And I think that we've got a really critical role in building capacity around our ability to collaborate within our own sector and across sectors. And finally, we respect culture and context, and I think there's a lot of information and a lot to learn from the study, particularly with Aboriginal families, and particularly as we go forward and have a look at how we're actually working with Aboriginal families and community. Just a couple of other things that I'd just like to add. I think it'll be really good to know about how decisions are made around the coming into care and how children and also their families experience that. And the work that Professor Cashmore in particular, like looking at felt security and understanding that and the child's experience within care, I think has enormous potential for us in terms of actually how we work with children and families. And having some, I suppose, like currently it's a lot of focus on associations between different variables, having some understanding of sort of what might be some of the predictive variables for better outcomes would be good to know. The issue at the very end there around consistency of practice is a challenge, I think, for us, and obviously lots of reasons why that might actually be so. But considering some innovative models and the kinds of work that we might actually do across and within our districts. That might be all, apart from investing in caregiver satisfaction. That was that little pearl there at the end, which was kind of tossing out to us a bit of a challenge, what a difference that makes, and how simple that sounds, but actually, I think it challenges us around how we might actually do some of our practice and where we might consider some of our focus might be.
Okay, hi, thank you. So I'd like to start talking about Professor Judy Cashmore's research on children's relationships. And I think her opening point about how children in out-of-home care, we expect quite a lot from them in terms of their flexibility. an ability to adjust to different relationships moving in and out of their lives is very important to note. And it does have a very big impact on their well-being and their outcomes. And what I think is very interesting, especially with regard to CREATE research as well, and also comforting about Professor Cashmore's findings, is that there's an emphasis on the importance that children themselves place on sibling contact, and that is really important to them, and that does continue throughout their journey in the care system. Now, this is consistent with research in the field, as well as with CREATE Foundation surveys with young people. In 2013, in our report card, it was again indicated by children and young people that they did desire more contact with their siblings in care and with those who they were not living, and that where possible they would want to be placed with them. And I think, as we all know, that the sibling relationship is one of those longest relationships throughout our lives, and that is why it's very important, if they can't live together, that they do have that contact. Now, regarding further research on this point and data collection on children's relationships in out-of-home care, I think it would be really interesting to gain some more insights regarding who children would like to have more contact with and how they would like to have that contact, if that would be possible in the POCLS study. And that I think it's really important that the voices of children in highlighting how they feel in carer household, especially with regard to having a sense of belonging to the house to the family in which they live with, is critical to improving outcomes for children in care, as we know. The next section on placement stability, so of course, as we know, placement stability is critical to improve outcomes for children in care. But the point that Dr. Fred Wilskin, sorry if I mispronounced your name, mentioned towards the end about the district consistency, again, I think this is really important to note, as the former speakers have already said as well, but also in linking to caregiver satisfaction in that relationship between caseworkers, the carers, and also caseworkers and children. And that the diverse, I guess, the lack of consistency that has been found throughout districts really further kind of adds more emphasis to the fact that that it is such a subjective thing, that that building that relationship with carers and having that ongoing support and a strong relationship is subjective, and that's why it's so different across different districts, but that it's so critical for the ongoing support for children and carers. And then overall, I just wanted to move just then back down to the focus on support for foster and kinship carers, and that, as we know, I think what's really beneficial across the POCLS findings overall is that it's really pushing for more support to kinship carers. Now, I think this is something that we all do know, but I think what the research is showing, it's really making us ask the question, what type of support do kinship carers want? And how do they want to receive this support? And I think, as the researchers have said, this is something we don't know yet. There is mixed responses. Do kinship carers want support from FACS and from caseworkers, or do they want to be left alone? And I think this is a really important point, and some more research would be really great to see in this area, because I think in terms of practice, this is where we're going to have the greatest implications, the greatest impact in trying to improve wellbeing for children. At CREATE, we do hear anecdotally from children and young people, but they do want to choose kinship placements, but that it's important that those kinship carers do have support, and that as they are more financially unstable, or they have lower socioeconomic status, it's important for the sector to provide those kinship carers with support to enable young people to have the same outcomes as the people in foster placements. So lastly, I think that where there is a a bit of confusion around, do kinship carers need the support and what do they want? There has been, I guess, a shift with regards to should the government be providing support to kinship carers, and should that be independent? Should that be is it social support that they want? Is it through a community network as opposed to direct or controlled support from the department and more casework support? So I think those are really interesting questions, and it will be really great to see that research come out of this study as well. Thank you.
Thanks, Lisa.
Look, there's a few kind of interesting responses I guess I have to what we've heard this afternoon. What strikes me is probably the motherhood statement, which is how important is research. From an operational point of view, what you often find is that you're driven by the outliers to a certain extent, that your exposure is to the critical incident, and you can start to form a view based on a set of assumptions that, when you've got fabulous longitudinal studies like this, really put those to the test, because you can literally be driven by the kind of complaints and the placements that are falling apart, and that can really plant seeds in your head about people's experience that in fact need to be put to the test. And the beauty of this study is that it's absolutely putting those to the test. The other thing that really struck me was the need for, we're talking about support, and I think I see that in a few different ways. I was addressing a grandparent forum a couple of weeks ago in my district, and we tend to, I think, get quite tunnelled around financial support when we start to talk about support, particularly for grandparent carers, and I think it's too narrow a view, really, of what's required. And, it's easy to get into the kind of media space around what if you throw more money at it, it will make things better. And I think what this study is pointing to is, in fact, that it's a complex web, potentially, of support that's required. And that, in fact, it might not have to cost us any money at all. It's really us taking less of a one-size-fits-all approach to carer support, and really starting to think much more creatively and innovatively, I think, about how we can reach out to people to say, tell us what you need. We tend to, as I say, I think, operate on a set of assumptions and develop packages that we think are helpful without actually testing that with the very people that they're designed to assist. So I think it would be really helpful for, this study provides us with some really good foundation material to go out to talk to the people, to the whole range of carers, to say, what is it that you think would help? And for some that might be the caseworker, and they might have a great relationship for them. For others it will look very different. I think the other bit around service support is the clear indicators around building a service system that is, again, more flexible and responsive to the varying needs, and that we can really only deliver that in concert with our other government colleagues, that, understanding the impact that school, for instance, has on these kids, the changing of school placements and the impact that has on educational outcomes for them, the access to health pathways, but the right health pathways, again, not that kind of sheep dip approach to children. And I say that respectfully because I think we've taken, and sometimes it's hard, government is big and it's tricky to be nimble, and I think sometimes we do look for a kind of universal approach, but often that might be what's driving those families away. People won't reach out necessarily to our system, particularly I think kinship carers, because they're fearful that exposure, it makes them transparent to the system, and that may have unintended consequences for them. And so we have to build systems of support that feel safe and genuinely supportive. It's utterly heartbreaking. I always think, there's nothing worse, really, for caseworkers and anyone who works in our agency to see where we've removed children from their family of origin only to have things go terribly wrong in their placement, because it just feels like secondary abuse. It's just an awful failure of the system. So, there's so much material. It's just so deep and rich, this study, I think, for us to start to use as a base to move forward. And, the thing about research is when you know what works, what you're left with, when you've got good evidence base to say this is what's going to deliver the best outcomes for these vulnerable kids, it provides you with the absolute moral imperative, really, to build the system that will deliver it to them. I think that's the challenge, certainly, for the department.
Thank you.
I'm going to make some overall comments and then a few specific comments about the 3-4 groups. The overall comments, I think my overall comments will link to the specifics in some overarching ways. And so the first general comment I want to make is that this is a great rich database, and let's hope we can continue the study over time. One of the things that I think we need to ask ourselves, or the researchers hopefully can ask, how do we link this study and what it's going to tell us to the legislative changes that have happened, once it's started? So how can we think about linking this to the permanency hierarchy and the associated outcomes in the legislation? And maybe that's a bit of a tricky one, but I think it's actually really important. In terms of the size of the sample, and I completely can't keep all those numbers in my head, but my memory is that there was in both the big sample and in the final orders subsets a predominance of younger children rather than older children, and I think that is really, really important, and I think we need to slice and dice the numbers by those age groups and by particular clusters, particularly in relation to the permanency hierarchy and the directions of that legislation. So the proportions of age groups and the breakdowns, and obviously I'm going to say that I think we need to look very closely at the younger children in the cohort, and I think that some of the material that's being presented today as well perhaps has some differentiation around, if you broke it down by age group, what it would look like. In terms of relationships, differences in ages in felt security, difference by age in felt security, I think is really, really important, and I'm sure that's something that's going to be looked at. Purposes of contact is really important. So contact itself is a term that I think begs breaking down in terms of the reasons why we have contact, and also in terms of the permanency outcome that is planned for. And that hopefully that data is available in terms of what the plan was for the child, not just that it was a final order. So, there's considerable detail, I think, in that care planning process, and I'm not sure whether that's available, but hopefully it is, and if not, how can we incorporate it? What is supervised contact? What does that mean? Who's actually supervising it? If I put the non-government and the ACWA practice lens on it, we would say that over the last probably 15 to 20 years, there have been changes in relation to who supervises contact. 20 years ago, many carers supervised the contact. For various reasons, at a practice level, we now have much more professionally supervised contact, and that has implications both for children and for carers, and also, of course, financially for the system. So I'd love the research to look a bit more closely at that. And there is a bit of already published research around the impact of strangers, for example, picking up very small children and driving them distances to see someone else. I think there's some interesting interface there with the family law sector, where we have, for want of a better description, warring parents who are able to, not see each other and drop their children at the front and back door. Now, whilst that's not necessarily the case in the care system, we are, there was a comment made in relation to kin that kin carers are often the ones left to negotiate the very tricky family relationships around, perhaps drug addicted children, adult children, whereas the foster carers with the non-kin placements are perhaps having the supervised contact for whatever reason. So there's some interesting drilling down there, I think, in relation to that. The social media, just to comment briefly, the thing that sprung into my head there around, well, there's not much social media contact happening. I mean, if the predominance of the sample is very little children, I mean, that would explain that, and the vigilance around social media that that, and I guess there's varying levels of vigilance, but tiny children are probably less likely to be using social media than adolescents. Few comments about placement stability, time to first change, and the reason for the change and why districts vary. A comment there, I guess, about the non-government sector, because the non-government sector has more than 50% of the non-related placements, so the non-kin placements. The kin is predominantly still in the department, and I think that's as well an important thing for the research to take account of in terms of the messaging. So carer support there would be something interesting to look at in relation to kin and non-kin. I'd be interested in knowing in relation to why districts vary, is there a connection there between the number of non-government agencies in a particular district, whether, how many placements are with non-government agencies as compared with the department. Connections between the move and the purpose of the placement. I think that's a really important thing to look at. So, just some final comments about kin and support. There's a relationship there, I think, to look at. I need a glass of water, actually. Can someone get me a glass of water? I'm going to cough mightily. Thanks, Janet. I agree with the comments of the people who've gone before me about kin. I'd be interested to see some work on that less access to social support for kin carers in relation to our Aboriginal kin families, because I suspect that many of us would think that Aboriginal kin hire social support, so I was quite surprised by that, and I think that would benefit from a closer look. Hospital emergency departments, I mean, obviously, we'd all be surprised about that, but again, if you connect that with, if you can connect that with the financial status, and if you say, well, the kin look, less financially able, particularly the grandparents, and if they're also Aboriginal families, they may well be using our hospital emergency departments, for numbers of reasons, including financial reasons, and obviously that's a big drill down, but I think that's worth a look at, and it also has implications for cross-government because use of health services, of course. And in general, the higher health needs, and in relation to access being slightly older age groups than we might have thought, if we looked and tried to make some connections around developmental outcomes, it may be that the very small children who perhaps have been subjected to trauma which is not going to be evident until they start to grow, and also diagnoses of developmental related disabilities, is not going to happen early on, and that may well explain as they grow that increase. Thanks.
Thank you. It's always good when you come to the end and you hear what everyone else says before you, and it's really good to be able to say I concur, but I do, and certainly education does. Look, there are just a couple of things that I'd like to pick up in terms of the study, and I would also like to say what a wonderful study it has been, really rich source of information. And it's not often that we actually get something that is longitudinal, that we really need, that we can benefit from, and really look at how we can inform our practice, our policies to, look at how we can make changes, for a particularly vulnerable group. In education, we do acknowledge that, children and young people in out-of-home care are some of our most vulnerable children that we deal with day in, day out in our schooling and in our classroom. So to have such a rich level of data, and to have all of the discussions that we've had since the project was really started, has been really quite tremendous. One of the other speakers, I think, mentioned about linking some of the data. What are we going to be able to do to, initiate some of that work? And I think that's something we need to really look closely at and make sure we don't lose sight of. And I know we've already had with some of our agencies discussion about, what sort of data can we pull together that might give an even richer story for these young people. Stability of placement is something I would just like to comment on, and I know a couple of others have as well. Stability of placement, we all would acknowledge, can be critically important for young people, and when they have dislocation within their family, within the home environment, to provide stability wherever possible is a really important thing for children and young people, particularly when they're at such a vulnerable time and can feel very much alone. Stability of placement in schooling can be really important too, and we know when kids have lots of gaps in their attendance or their participation in school, we know what the evidence tells us in terms of how much schooling they actually lose, and for so many days they lose 6 months of their schooling and so on, and so that stability and that capacity to engage and that school attendance is really very important. We know it can have an impact on life outcomes and their learning outcomes as well, so that stability of placement and how we manage that that stability of schooling wherever possible is an important thing. Look, relationships is one of the other things that I would like to pick up, and about sharing information and that collective wisdom that we all have, and when we share that collectively, we can really make a big difference for children and young people. And we know we've got the landscape has been changing over recent years, and no doubt will continue to do so. So we've got a lot of players. How do we make sure and look at ways in which our policies and practices can really encourage that really rich two-way interaction and sharing of information, and really that comes back to relationships as well. So when you've got the relationships in place, you feel more open and willing to be able to share information. So that's one thing that I would say is really very important. But one of the things that we've been grappling with, we talk about support for carers, we talk about young people, where they've come from. One of the things that we need to really look and make sure that we don't overlook is support for the young people themselves. And, we can provide wraparound support. We're all very much committed to that. That's really important. But I'm reminded of another forum that FACS held a little while ago around out-of-home care, and one of the young people herself who was someone who exited out-of-home care. And one of the things that she said very strongly that really hit a chord is, we often feel that it's done to us, that people forget to tell us along the way why they're doing things or why decisions are made. And so when we talk about support for carers, how important that is, we know. I think we need to look at how we can really provide that support for young people. And what I mean by support is not that necessarily that wraparound that absolutely must be put into place, but also to take the children and the young people on the journey. The young person I refer to, I remember her saying even when she was 7 and 8, she remembered people actually making decisions and things happening, and she never knew why she was taken somewhere and something happened to her. So how do we really focus in on that, involving that young person in the journey and empower them to be part of the decision making at whatever age that might be, so that they don't feel like it's being done to them, but they've got some power over their circumstances. Look, support for carers, yes, we would absolutely agree that's such an important thing. And for something like schooling, how do we, one of the things that we're grappling with, how do we engage with the carers, particularly when kids move placement or they're with a new carer, and some of the things, how do we make it easier for the carer to be able to navigate the education system. And so we know we've got kids that have experienced trauma, that's been referred to before. We know we've got kids from a whole range of backgrounds, but when there's a young person who needs that real ongoing support, there's been a lot of trauma, they might need additional services and supports. How do we support the carers to be able to navigate the processes without it being too overwhelming for them as well? So that's something that we take away from the work that's been done. Look, some of the things in terms of data was another issue that was mentioned as well. Some of the things that we're particularly interested in when we look at kids in out-of-home care that we've also been trying to look at that could be something where we could go further with this is, things like if we're looking at schooling, what was it like for the young person before they went into care? What was their school attendance like, for example, before they went into care? Was it good? Was it not good? Was it really fractured? Had they had a number of school enrolments? Had they had long absences? Because some of those things can also impact on trying to get a young child or young person settled into a new schooling environment, saying we need to have really good attendance, but they've really not had that before they went into care. So it's one of the factors that we need to really consider in terms of where to from here.
Thank you,
And I think that's yes.
And thank you. Yeah, I just wanted to make a few statements. Firstly, I'd like to just acknowledge the traditional custodians of this land and pay my respects to the elders past and present, to Aboriginal colleagues in the room today. Like everyone else on the panel, studies like this are really important, but I think the thing that really landed with me from an Aboriginal perspective is the importance of not only having this research and realising it's there, but actually using it to guide our practice today. We're in a lot of reform. There's new legislative practice coming in, and I think the biggest one that stands out for me as an Aboriginal person working with Aboriginal carers, kinship carers, and caring for Aboriginal children is around guardianship. And so for me, some of the research that was shown throughout that talks about stability of care, the hostility in supervising contact visits that kinship carers face, for me is around a lot of the concerns that I'm hearing in the community around guardianship orders for Aboriginal children in care, and I think it's something that we really need to consider. So I understand that we've got a lot of our kinship kids still sit with family and community services, and I speak with family and community services carers who are saying that they've got the decision and we're looking at rolling out guardianship orders, and there is a real fear there because of what the data is presenting. I've got birth parents who talk about where there are guardianship orders in place, they talk about having fallouts with their sister who is the primary carer whose guardianship contact just is null and void. Mum said, I'm going to take the matter back to court. It's a he said, she said, and it's a real struggle. So for me, this evidence highlights the issues, and I think, speak about this, the contentiousness of Aboriginal children being placed with family and wanting to give self-determination to Aboriginal people to make decisions, but it's fraught with danger if we don't do it right. I speak to colleagues in an early intervention setting all the time, and a number of Brighter Future services who tell me that 60% of their cohort is made up of Aboriginal kinship carers. These are people who need the support, and I think it's because if we look at all of the other elements that come into place, access to health services, housing issues and the like, Aboriginal people who are taking on the responsibility of caring for their own, and we all want to do it, particularly our grandparents, and I think we see the results there that say our grandparents can do it because they've raised their families and they have a strong commitment to not want to revert back to the days of the stolen generation, so there's a steadfast commitment there. When we go down to the levels of other relative carers, and I like that we broke this study down into grandparents and then other relative carers, there is a difference. There's a real commitment for Aboriginal people to want to care for their own, but they place themselves in positions of danger in doing so because there's overcrowding in houses, there's not enough of, we look at social housing as our options for majority of Aboriginal people. I think, if we're looking at reality, there isn't enough there, so we look at overcrowding, and this is leading to our Aboriginal kinship carers having to have that more support, being linked to Brighter Future programs, which is then resulting in everyday Aboriginal people having their children removed because there's nothing for them to access. So I think the benefits of this study needs to guide the practice and the decisions that we're making at a legislative point of view, because we need to learn from this, because it's not just about Aboriginal people having the support of financial support services, it's about having the supports behind them. So I have a number of kinship carers who are part of my service at KARI, and I say 70% of them initially said, look, we want to run our own race because we've had to do that from this point, from the time that we were previously a FACS carer to having that support and saying it's a lot easier done collaboratively. It's really important. I think one of the things that stood out for me in the data around the health needs that said that Aboriginal people who had access to an AMS were addressing the health needs of their kids, and I think that shows that Aboriginal people need a one-stop shop model. They need, there's a real fear of accessing the mainstream services, not only for wait list times, but it's just that fear and stigma of going to a health department to access various services. It needs to be something that's culturally inclusive, that is a one-stop shop, so that all areas and realms can be addressed with. I think one of the things that I'd like to see the study break down, if they haven't already, is analysing the data that's for carers caring for Aboriginal children, if there is a difference between Aboriginal carers versus non-Aboriginal carers across the different realms around placement stability. So for instance, if you're an Aboriginal carer for an Aboriginal child, are you more than likely to stick it out with those supports because of that connection to culture as opposed to a non-Aboriginal carer? And I think it's really important that we do break that down, not that because we've got an Aboriginal placement principle, we see it as important to follow, and I think we've invested in it in terms of practice. I don't think we follow it to the best of our ability, but I think if we take the data and we recognise the importance, hopefully we implement it into practice and we see better results moving forward.